Okay, everybody, hello and welcome to the third video that we are doing in partnership with Ascension Wisconsin. Today I am joined by Dr. Lombard, and I am so excited because we're going to talk about some new topics that we haven't yet covered, not just in relationship to women's health, but also kind of a more full body health discussion in our post-pandemic, still COVID around, weird, confusing kind of environment right now. It's a strange time to be a parent and to be trying to take care of our kids' health and ours. So thank you for joining us today, Dr. Lombard, and tell us a little bit more about you.
You're welcome, and thank you for having me today. So my name is Emily Lombard. I am an obstetrician and gynecologist at Columbia St. Mary's, Milwaukee. I'm part of the PMC group, so I take patients right there at the Medical Commons, right across the street from the hospital. I grew up in Illinois, in northwest suburbs of Chicago. I went to undergrad in Iowa at Cornell College. I moved out to Pennsylvania. I went to Lake Erie College of Osteopathic Medicine for medical school, and then ended up back in Chicago for my 4-year residency program. I joined a private practice and was there for about the last decade or so, practicing and treating women in the Chicago area, and loved my job there. And about 2 years ago, I met my now wife, who was up here in Mequon with her amazing 5-year-old daughter. And we got married about 1.5 years ago, and here I am in Milwaukee.
Congratulations!
Thank you.
You're like still like a newlywed.
We are still newlyweds, pretty much, yeah.
Aww. It's so awesome.
Amazing. It's been amazing. So I commuted back and forth to Chicago for about 1 year, and then decided it was time to be up here full time, and found the job at Columbia St. Mary's and fell in love with it, and it's kind of taken off since then.
So whenever I find out that somebody's relocated from Illinois to Wisconsin, I always have to ask if there's any sort of sports affinities that we need to get out of the way right away.
Well, we probably should. So of course, Chicago, I am a Cubs fan and a Bears fan. I do like the Brewers. My daughter is, yes, my daughter is a huge Packers fan. Goes commenting both of us, shouting, "Go Packers, go Packers, go Packers." So we do have a lot of Packers things in the house now. It was easy. My family was from Chicago, so they're also Bears and Cubs fans. So we didn't have any issues there. But I very much embraced Wisconsin and am loving it so far, and very much into the sports up here. So it's been great.
Fingers crossed we actually get sports at some point.
I hope in some way, shape, or form there are sports to happen for everyone. I agree.
Yeah, we need it. We need it. We need that. So like, we need something to cheer for and to like, you know, get off the couch for right now. So.
I agree.
Okay, so tell me more about Columbia St. Mary's, in particular when it comes to where you practice and labor and delivery things there. And because I know that I've just heard some rumblings that there is some new developments that moms.
There are a lot of new developments at Columbia St. Mary's. So I'm a part of the Ascension group. I belong to the Prospect Medical Commons group. So there's quite a few docs with us. So our main office right now is at the Prospect Medical Commons building right above Whole Foods across the street. There's also a newer office that opened up last year in Shorewood. And actually we're opening up a new office down in the 3rd Ward. So I'll start seeing patients down there on July 1st with a few of the other doctors. Very exciting. And it's going to be a great addition. And Columbia St. Mary's itself, the labor and delivery, has a brand new unit that actually had the ribbon cutting ceremony on Friday. So it opened up yesterday for the first set of patients and deliveries there. There are, I believe, 12 labor and delivery private suites. They're beautiful. They're state of the art. They're going to be wonderful. There are 10 antepartum rooms, which is where patients sometimes stay a little bit more long-term before they deliver, or sometimes we're trying to have them not deliver just yet. There are brand new, amazing operating rooms, 2 recovery rooms. The NICU upstairs has already been revamped and it has private rooms and everything. So it has that kind of same look. It's more of like a spa-like atmosphere. I think women and their families are just going to love the new environment.
Every time I hear stuff like that, it's almost like I want to like rewind the clock and try to like go back and do it differently, because the idea of having births being in a spa-like atmosphere was like not something that was even remotely on my radar a decade ago. Moms have it so nice right now. Like they really have some amazing options when it comes to their birth experience. It's really incredible.
Oh, I agree. And I think that the best thing about women's healthcare now is that women have so many choices. Women can kind of make their birthing experience exactly what they want it to be. And these new labor and delivery suites kind of give us more ability as physicians to help incorporate a lot of women's plans into our full birth plan experience. And it's going to be wonderful.
Speaking of that, like, is there anything unique about your practice in particular that you would want to highlight?
Sure. So I do pretty much comprehensive gynecology and obstetrics. I would say probably the majority of my patients are still in childbearing years. I love delivering babies. I love just obstetrics in general. I think the connections that you make with patients when you start seeing them, even sometimes before they meet their now partners and get married and choose to have families, or sometimes not choose to have families, but have families and decide to come and see us, and we help them throughout those experiences. Those are things that stick with patients and moms throughout their entire lives.
Totally.
So one I love is when we have patients and they refer their family and friends, and then we take care of full families in our group. And we see aunts and cousins and moms and daughters and sisters come together. It's one of the kind of my most favorite parts of the obstetrics that we get to do. I love office procedures. I do a lot of minimally invasive surgery and procedures in the office and out of the office. And I think just overall kind of comprehensive health, enveloping preventative medicine, working with mental health, just the full-on picture. For a lot of women, we are their primary care providers. They oftentimes don't have other physicians besides us. So, you know, I try to make my practice as all-encompassing as I can make it.
Yeah, and I think what you said, it really resonates with me too, because like I remember we had to move away when my youngest child just turned 1, like, and we literally moved to the Milwaukee area. And like I remember like going in for his 1-year well child checkup, knowing it was gonna be the last time I was seeing the woman who had like guided me through all of my births, pregnancies and births, and like all of the, you know, everything there. She had seen me and my children, and it was like heartbreaking to say goodbye to her. So I love how you mentioned that, like that it becomes like this sort of like a family kind of feeling, and that you have this special relationship with that care provider, because that was really hard to leave her.
It is. I mean, it was very hard for me to leave Chicago, and I had patients who came into the office. It literally felt like I was breaking up with people over and over again. And I'm sure I will have some, it's not that far, who will come and visit here. Because like I said, for many women, this is the most exciting times of their lives. On the opposite side, for some women, it's the hardest days of their lives that we go through as well. So just those connections we make, they're things that will kind of last throughout our entire lives.
Totally. Okay, so let's dive in, because we're in this, like you were saying, we have this kind of like stressful environment right now. Moms are, women, even if there aren't moms yet, are dealing with a lot of uncertainty and questions, and like especially in our state, where all of a sudden it was like, JK, safer at home, done, bye. And now we're like, what do we do? Like, can we take our kids? Do we go? What's happening? So we've been kind of talking about navigating this confusing situation, and I want to zero in on a couple specific questions that have been brought up so that I can pose to you that are in that realm. So number one, what if during safer at home, during quarantine, whatever, we missed our annual Pap? Should I be concerned? Should I be like trying to get my butt into the office as fast as possible? Let's talk about that a little bit.
Okay, sure. I think this is a great question that's probably affecting a lot of women in Milwaukee. When the Safer at Home order actually happened, I was on a medical mission trip in the Dominican. So I came home and
Oh,
life was changed. And, we ended up having to
welcome
cancel
home.
a lot of, I know, we ended up having to cancel a lot of patients, right off the bat just for their annual visits. So I think a couple things kind of with that question we can talk about. So one, Pap smears in general. Overall, the newer recommendations for most women don't actually need an annual Pap anymore. So PAPs are done typically about every 3 to 5 years for most women. So if this happens to be for a Pap, it's okay. A couple months for the majority of patients is not going to make that big of a deal. So what we've done is we have a list of all the patients that we have canceled. We still do encourage, even though I say we don't need a Pap every year, we still do encourage annual exams every year. Now, part of the annual is going through history taking, do you have any new medical issues going on? Are there any new medicines that might be affecting different reproductive health? For the typical patient that doesn't have any sorts of issues, we're doing some of the visits. Let's say we need a refill of something. What we're doing is you just call your provider. Most providers are doing telemedicine visits, whether it's just via phone call or via platforms like Zoom. And a lot of the visit can actually just take place over a conversation. And typically if we're in good health, most providers feel comfortable giving a month or two of refills, and that's what we've been doing. We just started last week opening back up the office so that we are going to start taking patients in again who have more preventative care and more annual exams and things like that. So for those, it's been about 2.5 months for some of those patients that when we started to cancel.
Yeah.
List, we're going to start getting them back in. But if in the meantime, if there is anything going on, please don't hesitate to reach out to your provider because most certainly there are taking telemed visits and can do quite a bit of the visit even over a phone call or a video chat.
And what components of that annual exam, because a lot of it is conversation that can be done via telemedicine. Mm-hmm. But then there are other things usually that involve, actual physical examinations, like the breast exam and things like that. How is that kind of being navigated?
So for the majority of people that just are coming in for their preventative exam, their annual gyne exam, and don't have any issues, those we're waiting until it's safe to bring them back into the office. Gotcha. Because it is important to have their breast exam, for breast cancer screening, to have their pelvic for ovarian cancer screening. And sometimes, especially with certain mental health things, being in person does make a big difference. So if there's absolutely nothing going on that's urgent or pressing, or you don't need refills or have anything specific that you want to be seen in the office for, those patients, we're just asking them to delay a month or two until we get caught back up with in-person exams. Where the other certain things, I have itching, I have discharge, things where we can elicit more of a history just by talking. We're happy to do those telemed and just prescribe something over the phone. And then if we're still having issues afterwards, then we're bringing those patients into the office.
Okay, that makes sense. And on that same note, what if it wasn't a Pap I missed, but it was a mammogram? So if that's something that's on my list every year that I'm supposed to be taking care of and I missed my mammogram, what are kind of I know that it's probably a similar way where if it's just a checkup, we're catching up, but are there specific things that would make that a bit more urgent?
Sure. So I think the biggest thing when trying to decide for things like mammograms is just to make sure that we're all educating ourselves and know what to watch for at home. So when we do see patients in for annual exams, we're now teaching self-breast awareness. So what that is just knowing our own bodies, things that we watch for when we're doing exams at home. Do we have any changes in the shape of the breast? Do we feel any masses? Are there any skin changes, dimpling, redness, warmth, things that are happening, nipple discharge, things like that? If any of those happen to pop up, those sorts of things, we don't necessarily want to wait till our annuals. You want to call your provider right away because we're still doing mammograms and ultrasounds and things like that at the hospital for patients that need them. So don't kind of delay things that we think may actually need to be seen. So reach out to your provider, describe your symptoms, and the provider will kind of work it through whether they want to see in the office or get you set up for your mammogram and ultrasound that way.
Got it. Nope, that makes sense. So I'm looking for those those red flags, those warning signs. Those are going to kind of light a little bit more of a fire under your booty. Makes sense.
Exactly. And I think women that have, family history of breast cancers and things like that, that are on more the 6-month or the BRCA positives, a lot of those patients we're not necessarily delaying. Those are the ones that we're getting in right away, kind of prioritizing based on symptoms.
And I mean, are there particular precautions that, like, if, you do have to go in for mammogram, whatever, are there any specific precautions that you would recommend that women be taking above and beyond, like, since they're going into the healthcare environment, into that, clinical environment, when it comes to just protecting themselves?
Of course. So now that we're kind of opening our offices up, I think the first thing to know is that the offices and the hospital are taking precautions for patients, making sure they're doing screening on every patient before they come in. So if you do have something scheduled, expect a phone call asking about, contacts with sick patients, whether or not you've been sick yourself. There's a pretty strict but small group of questions that kind of go over how are you doing. So everyone's being screened before they come in for those scheduled visits or ultrasound and mammogram appointments. We are asking everyone to go ahead and wear some sort of a face mask when they come into the hospital. They're doing social distancing, so making sure that, everyone, even the chairs in the waiting room, are more than 6 feet apart. We're trying not to have women sit in the waiting room very long. So as soon as they check you in, it's kind of a rapid check-in, get you in to see the practitioner or the tech right away. So I think it's going to help make patients more at ease, knowing, because I do have some patients who know that they're due for things, but are a little bit leery about making appointments or coming in. So I hope that everyone does understand that, offices and hospitals are doing everything we can to make it safe. And that's kind of how we're incorporating, trying to decide which set of patients to bring in when, and based on acuity and sickness.
It's going to be an interesting few weeks, I think, as people are starting to slowly try to reacclimate to real life. So that's really helpful to know that those, even just those environmental adjustments are being made to try to create that part being that much easier and more reassuring and feeling like it's safe for me to go. So that's really good because, I guess I can only speak for myself here, but I have a feeling I'm not alone in that when it comes to taking care of my health, I try to come up with as many barriers as I possibly can to avoid doing it and take care of everybody else first. And then you throw a pandemic in there and it's like, oh man, too bad. I can't go in for that. So it's good. I think it's awesome that barrier is being wiped out. And it's it's okay. We've got you. We're going to take care of you. It's okay.
Yes. I think as women and moms, we tend to put everybody else first. But, our own healthcare is just as important as everybody else's. And yes, we're doing everything we can to continue to make it safe for the pandemic.
And also on that note, we are in, I've lost count of what week we're in at this point. It could be 9, it could be 90. I don't know. All I know is that it has been a long several weeks. And I think it goes without saying that for many people, our mental health has really been affected by all of this. So if you were speaking to one of your patients and whether it's via that telemedicine visit or they're in for one of those exams and they're expressing things that are making it clear, my mental health has really taken a hit during all this and I don't know what to do. I don't know how to adjust. Sometimes I can speak from the experience on this one too. It's hard for me to even describe what I'm feeling, why. I just know something is wrong and off. So what are some coping strategies that you may recommend, or how should they even bring this up to their healthcare provider if they want to communicate? I'm struggling right now and I don't know what to do.
Sure. These are great questions. I think, the biggest thing to realize here is that probably everybody's mental health has taken a hit in some way, shape, or form. So knowing that you're not alone, I think is going to be part of the battle here. As practitioners, obviously our job when women come in for their annual exams and things like that is to broach the subject of mental health, to make it less scary, to kind of open up the lines of communication. Obviously, when women are staying at home and not coming in for visits, I think this is one of the times, that as women, we do sometimes have to put ourselves first once in a while, and mental health is one of those things where we really need to make sure that we're taking care of ourselves in that aspect. I think some of the easy things just that women outside of office visits and speaking to your physician that we can do to help each other, just, checking in with each other, sending text messages, phone calls, checking in on our neighbors, just making sure that everyone has what they need and are taking care of themselves. I think as women, we do a great job, obviously, of taking care of everyone else. So as far as mental health now, some of the things that we can do for ourselves, and if we were having a teleconference, call, things like that, I think some of the things that we can easily do at home, try to increase our exercise. Exercise is great for mental health. Exercise is great for stress levels and things like that. So obviously, if you have the ability to do things at home in your basement, it's amazing. As we get sunny days out, sun itself can be very great for mental health. So trying to do some of the exercise outside, taking the kids, going just for walks, bike rides, things like that, I think are great. There's a lot of different things that we can do for meditation, relaxation, breathing techniques. I think those are all great things that can help with mental health. I think a lot of us have kind of found different and more creative ways at home to kind of blow off steam to help with our stress levels. For some of us, it's things like journaling. Some of us are doing different things on social media, online, trying to find new ways to kind of express ourselves. I think, whether it's finding interesting shows that you like on Netflix, sometimes, it's just taking time for ourselves, which I think as women, we don't necessarily do the best at, is just having some me time, whether it's, the kids are home, letting them watch a movie and you go and do something for yourself for an hour. I think it can make a huge difference for mental health. Part of it, just knowing that as practitioners, we are here, we have televisits available. There are amazing mental health specialists throughout all of Milwaukee land that we can refer you to. So please, just reach out to us, whether or not you're due for any sort of visit, and say, hey doc, I think I'm having a problem. Great, let's delve into it. Let's see what we can do, if we can do some easy things at home. I think the other thing to think about and to remember is that obviously something like this is something we've never encountered before. So it's a very situational, hopefully temporary sort of a thing, where sometimes all of the things that we can do at home, and we know about all of these things we've been trying and it's still not helping, knowing that it's okay sometimes to be on medicine. There's lots of different medical therapies that do amazing things, and to not be afraid to reach out and say, hey, maybe I'm on something, but it's not working anymore. I need dose adjustments, things like that. And that's one of the great things, is that hopefully most women are comfortable enough with their gynecologist that we have this trust going on, that they feel comfortable to reach out to us throughout this time. Please know that we're here and reach out, and we're happy to have these conversations with you.
And knowing that it isn't necessarily forever, like how you mentioned, that none of us have navigated something like this before, and it's kind of a unique circumstance that's almost like, putting you into a pressure cooker, and like but it isn't going to last forever, right?
Right.
I think
it's not.
So. Okay, good.
It's not.
I keep telling myself that, and that's what's getting me through. So it better not.
Yes. No.
And like,
it's not. Vacations will come back. All of these things, things get better. I think that's a big kind of hurdle for a lot of women, is thinking that if I do decide that I need to go on a medicine, or together we make this decision, a lot of women feel like I'm going to be on it long term, and that doesn't necessarily mean that at all. For some women, it's very short term, a few months. Some women, it's 6 months, a year. But it's a ongoing conversation. There, great ways for us to wean ourselves off and to not be on them long term if we don't want to be. But they can make a huge difference, especially in these uncharted territories that we are in right now. Yeah,
and on that topic of anxiety and, managing our mental health, I know that sleep is a huge component of that. And
sure.
for me, in particular, like I have noticed over the last 2.5, however many months we're in now, like sleep has been a massive challenge for me when usually I wouldn't really have an issue. Like I am laying awake, like with all the worst case scenarios and stuff now, like swirling through my head. My sleep is just whacked. It is completely goofy. So, and I have a feeling I'm not alone in that. So what are some strategies that women can be incorporating to try to improve their sleep at a time of, you know, increased anxiety?
Sure. I think that, you know, a lot of these things kind of go hand in hand with what's going to help us with our mental health. If, you know, if we can do things that are going to relieve stress and try to relieve some of the things on our minds, like exercise, you know, the journaling, the meditation, I think relaxation, meditation, and breathing techniques are wonderful things that we can do right before we go to sleep to help center ourselves, to try to get some of the, you know, 10,000 thoughts out of our mind and concentrate on, okay, this is what's happening right now. And, you know, getting in a sleep routine for a lot of women is very, very helpful, which is hard when every day is different and we have, you know, 20 different balls that we're juggling in there and we're trying to figure out what we can do to not drop them. And so I think one of the things that we've noticed, and we've already talked a little bit about here, is that in this new time period, we are kind of attached to electronics, whether we want to be or not. Whether it's Zoom meetings, we're doing e-learning with our kids, you know, and they're on this meeting and that meeting, and we're texting our friends, we're calling our friends, we're FaceTiming our family because it's the only way that we're able to kind of connect with them. I think sometimes when we get ready to bed, that phone's been in our hand probably for, you know, 14 hours during the day. And, you know, I just as easily when I sit down and lay down, I'm on social media and I'm looking at things. And I think one of the great things we can do with
then you drop it on your face.
Exactly. Is to set a time where you say, okay, an hour before I'm going to put my phone down, I'm going to concentrate on just, you know, talking to my family, talking to my partner, talking to my kids, you know, just having an hour for myself where I'm not talking to anybody, where I'm going to practice some relaxation and breathing techniques. Because I agree, I think the biggest thing is we're seeing all of these things on TV and on social media and on the news, and we lay down, and how can they not just be swirling around in our minds? And sleep, I think, been a big issue for women. So whatever it is that we can do to help ourselves, and I think you know, we've got quite a few things that we can try, and it's going to be different for everyone. There's not going to be a set thing where I can tell 20 patients the same thing. Everybody's going to kind of have a different thing that works for them. So it's going to be a kind of a trial and error. But I think, you know, setting your time and setting reasonable expectations that, okay, each day it's going to get a little bit better if I do this.
Yeah. I had to turn off the notification thing on my phone that tells me my screen time report every week. Cause like, I think at like week 4, when it was like, your screen time has increased by 52%, I was like, ah! So I just had to turn that off. I felt like my iPhone was judging me, and I didn't need that. I didn't need that energy in my life right now. So
nope, don't need that.
That got turned off. So, well, in the sake of time, we've got to wrap up for today, but thank you so much, Dr. Lombard. And when we
you're welcome. Thank you for having me.
Yeah, there's going to be a link to Dr. Lombard's bio in the description of this video, so you can learn more about her. You can see what available appointments she has coming up, and also make sure you check out the new info about that new sweet labor and delivery spa-like experience, because that sounds amazing. So thank you, and I say this to everybody because I know that it's been an crazy several weeks of being a healthcare provider and putting yourself out there on the front lines and putting yourself in harm's way, quite frankly. So thank you for doing that. Thank you for being there for women in a very unprecedented and dangerous time.
Oh, you're welcome. Thank you for you know, taking the time to talk to us. I think it's been very helpful for both sides. And yes, just know it will get better. We're all going to get through this, and please reach out if you need help.
Thank you.